We are XLynk Surgical. I'm Brody.
And I'm Ari. Currently in the medical field, post-operative adhesions are a major problem and cause complications for many issues. Additionally, current adhesion barriers are just not adequate enough. 5.5 million pelvic and abdominal surgeries are performed annually in the United States, and of these, up to 95% result in post-operative adhesions. An adhesion is when two surfaces in the body that are healthily and typically separate form fibrous bands connecting the two, which cause a lot of complications. These complications total 6% of hospital readmissions annually.
So there are three main types of complications that happen due to these adhesions. The first is bowel obstruction. Actually, 40% of all bowel obstructions are due to postoperative adhesions. Additionally, 40% of infertility cases are also attributed to adhesions. And the last one is chronic pain. And most people don't even realize that their pain is due to these adhesions. All in all, it costs $3 billion every year to perform corrective surgeries and maintain these adhesions. So there are several products that are available on the market today, but they all have drawbacks. Seprafilm is the dominant product by far, but it's only about 45% effective. It's also extremely expensive and very difficult to apply. For this reason, less than 2% of surgeries that could potentially benefit from an adhesion barrier actually use one.
As you can see in this rat study, Seprafilm is effective at reducing the amount of adhesions as compared to the control. However, a hydrogel type solution is even more effective, and that is the route that our product takes.
So what we've done with XLynk gel is we're developing a device where we can house the two components of the hydrogel in separate compartments. There's a pressure system driven by CO2 that drives both of the gel components through a valve and allows it to be sprayed into the body. So this demonstration shows how it works. So for a laparoscopic surgery, the surgeon first places the trocar and gains access to the abdominal and pelvic cavity. Next, our device is inserted in through the trocar. And finally, the hydrogel is sprayed into the cavity, which allows an even coating over all the tissue surfaces, which prevents postoperative adhesions from forming in the first place.
The market for postoperative adhesion prevention is huge at nearly $1 billion and growing at a rate of almost 7% annually. Seprafilm has the largest share of this market at 28%. However, they do not even address the laparoscopic market, which our product also plans to tap into.
We have a very unique business opportunity here. Number one, because we're taking the hydrogel approach, which is shown to be more effective than Seprafilm. And number two, because we're going into the laparoscopic market. If we were able to take advantage of just 5% of relevant surgeries, we would have annual revenues nearly $500 million a year.
We have the ideal team to work on this project because we have engineers, a surgeon, a pharmaceutical chemist, and a lawyer with finance experience. Ultimately, XLynk gel will result in patients with fewer abdominal adhesions. It will be easier to use. It will reduce surgeries for corrective problems. It will be better for hospital administrators, physicians, patients, and insurers as well. Thank you.